Hello, my name is Li Yimeng. I'm a senior at Communication University of China in Beijing. The paper I'll be presenting today is titled Analysis of the Framework of Media Reports on Policy Adjustment of Public Health Events. Regarding background information, the Joint Prevention and Control Mechanism of the State Council of China canceled its dynamic rolling policy on December 7th, 2022, in which several new regulations made significant adjustments. Both the People's Daily and Times demonstrate frame shift before and after the release of policy. This research used a combination of quantitative and qualitative method for analysis. Word frequency analysis for the quantitative part, mutual reading for the qualitative part, and content analysis using frame theory. So for the sample composition, news articles from People's Daily and the Times are from November 30 to December 14, 2022, a total of 15 days, with the theme of epidemic. Both newspapers take December 7th as the turning point, separating the content into two groups for each media, and use the frame theory to analysis and compare a total of 4 groups of independent texts. First, let's look at the content analysis of People's Daily. As we can see from the bar chart, the highest word frequency is epidemic, reaching 67 times. The second is containment, reaching 45 times. Risks, vaccination, detection, and other words account for a higher percentage. Before the lifting of epidemic containment policy, People's Daily focused on emphasizing the risks that the epidemic may bring and strategy that can take in to avoid the risk. Also, People's Daily choose use we to draw closer to the mass. In addition, the high frequency of reference to the test of nucleic acid proves that People's Daily in this period still focus on strengthening the efficiency and effectiveness of epidemic control. After the lifting of epidemic containment policy, the word with the highest frequency is people, reaching 42 times, followed by masses, which all reach more than 20 times. People's Daily begins to emphasize the opportunity that may arise from mitigating the controlling of the epidemic, such as economic development and return of a better life, and high frequency of mentioning fever, medical, health, and patients prove that the policy has been reoriented to how to ease the medical squeeze and strengthen the vaccination. As for metaphor, People's Daily adopt the framework of epidemic life risk before the lifting of epidemic containment policy, like to show how greatly epidemic affects people's lives, and therefore verifying the necessity and urgency of current control method, and reflects the outstanding contribution made by the central government. Yet, after the lifting of epidemic containment policy, People's Daily used frame of epidemic economic development to highlight the government's plans for the future, to stressing the achievements the government has made. Together, the framework presents a metaphor for looking to the future and keep everything under control. As for topic, before the lifting of epidemic containment policy, the theme People's Daily focused on combating the epidemic, like overcoming all difficulties, but with 3 sub-themes: safeguarding people's livelihoods, safeguarding industrial production, and safeguarding medical supplies. After the lifting of containment policy, however, People's Daily shift is focused to urgent needs for economic development, sound medical care, and timely response to people's need and protection tips, to emphasize the necessity of epidemic containment policy with overall core central on living with the virus. Both before and after the policy change, the People's Daily used the framework for conflict resolution. Its mechanism of action capitalizing on audience desire for peaceful life and its outcomes to motivate the parties involved in the conflicts to work toward a peaceful resolution. Now let's look at the content analysis of times. As we can see from the chat, protext is the word with the highest word frequency, and protext refers to the several protests in the Beijing against the dynamic rolling policy before the lifting of epidemic containment policy. It is also worth noting that lockdown appeared 15 times, restriction 12 times, both of which appear almost in all of the articles in this period. The choice of negative, even fearful terms such as lockdown builds a disturbing, even anti-human image of the dynamic zero-limit policy. In addition, economy together are used more than 26 times, which means that most of the article focus on negative impacts of closure policy on the economy. After the lifting of epidemic containment policy, the world frequency of China has dropped significantly and the data of related reports has decreased too, which indicates that the newspaper's coverage of the epidemic in China has decreased with the adjustment of the policy. And the world new is often used to refer to the New World Order, where the Times emphasizes that China's policy change will re-influence the world order and from a new economic and political situation. Many of the reports focus on severe medical resources panic squeezing on China, like including hoarding of medicines and round-the-clock shifts, and the world protests and restriction continue to appear frequently in attacks, demonstrating a negative attitude toward this policy. Before the lifting of the epidemic containment policy, the Times used the framework of policy threat to construct and reinforce the logic that China fails to implement the right policy. The prime of this policy is based on the view that there's no support for the policy. After the lifting of epidemic containment policy, the Times' attention to the topic began to decline. Although the framework of politic threat is unchanged, the level of condemnation declined. And as for topic, before the lifting of epidemic containment policy, the theme of the Times coverage centered on three aspects: the attitudes of those in power in China, the negative impacts of the policy on the economy and trade, and attitudes of Chinese population toward the policy. And after the policy, the epidemic containment policy, the theme of related coverage continued to include three categories, adding concerns about China's tight supply of medical supplies in addition to aforementioned political moves by those in power and the negative impacts on the economy. And as for the value framework, both before and after the policy adjustment, the Times used the framework of complex transformation, and for more specifically, the systematic flow frame. However, the content of the report after the adjustment is significantly lower, and the degree of prominence of this framework is relatively weaker. Overall, the People's Daily's coverage is more positive, using detail and facts to create heroes, or its content and storytelling to describe official achievements. Both before and after the policy adjustment, the frame used by the media is aimed at resolving or climbing conflicts, trying to idealize the current state, and creating a favorable public opinion environment for the implementation of the policy. On the contrary, the content of the times is more negative, highlighting the problem by focusing on selected facts, using pictures to reinforce the negative feelings, and focusing on depicting the negative impacts and negative feedbacks of the people, expressing dissatisfaction with the policy statement. The purpose of the article in Times is to reach a more ideal state of reality and to push the policymaker to improve their policy system. So here's the end of my presentation. Thank you for listening.